9 EKG strips you must know for the NCLEX. First is normal sinus rhythm. The easiest way to identify this is making sure that each R peak is evenly spaced apart. Then you want to see if a P wave is present and followed by a QRS. Next is bradycardia, a very slow heart rhythm. I like to think of the Brady Bunch, that old-time TV show that was in the 1960s. To remember, less than 60 is bradycardia. Next is ventricular fibrillation, or VFib. This one looks like a flopping fish that's just flopping around. So remember, with VFib, you want to defib, or basically defibrillate. Now VTach, or ventricular tachycardia, looks like a tombstone. And remember, you defib if you don't count a pulse, or you cardiovert if you can count a pulse. Next is AFib, or atrial fibrillation. This is where the atria are all flipping around here. The easiest way to identify this is that the R peaks don't match up perfectly, and there are no P waves. Next we have A flutter, or atrial flutter. Simply remember a fluttering bird, because this looks like a bird that flies. Now SVT is that super fast heart rate. It's called supraventricular tachycardia, a very fast rhythm. Next up is torsades de pointes, or torsades de pointes. I remember this as a big tornado in the heart. The number one treatment here is magnesium sulfate, because magnesium mellows the heart muscles. Now very lastly is asystole. This is our flat line. Remember, you can never shock asystole. The best thing we can do is get our hands to pump on the chest and also give epinephrine.